listening to the SoleStrategies podcast hosted by the team here at SoleStrategies. We hope you like the latest episode and thanks for tuning in.
Hey, everybody. Welcome back to the SoleStrategies podcast with your hosts, James Ray and Josh Willis, the only two J names in politics that you can probably trust with anything remotely important. Today, we're going to be talking about the COVID-19 pandemic, capitalism's interactions with it, particularly in the U.S. context, and talk a little bit about why we're all basically just being worked to death for the sake of corporate profits in the midst of a nationwide pandemic. So, Josh, how are you doing today?
Oh, I'm doing great. Entering day, 680 almost of the COVID-19 pandemic, at least as far as the U.S. context goes. And like you said, we are seeing, 2022 is turning into just another year, like we've seen the past few years of capital really coming into conflict with this new normal, quote unquote, of COVID, and how, the United States and the economy of the United States and the market of the United States is really prolonging this incredible pandemic that we have now been a part of for almost 700 days. It is one of those things that is mind-boggling to think of, back, 2020 when all of this stuff hit the fan, and there were people that were talking about, it's a few weeks off, whatever, we get a longer spring break. I know college kids were saying things like that. Here we are 2 years later, we're still very much in this reality. And I think that one of the things that's important for us as leftists, as critics of capital, to really take an approach or take a step to try to diagnose maybe what role capital plays in the prolonging of this. And I think that one of the easiest ways to start is, you see that joke about like the United States is saying, time to open up and quote unquote die for the economy, right? Back in, I want to say, in the early days of the pandemic, when Donald Trump made the incredible statement that we were going to be open by Easter, which, if you're keeping track, that is almost 2 years ago. And we were supposed to be open by then. And a lot of it was just because, productivity was at an all-time low. Everything was shut down, businesses were shut down. And at some point, the machine in Washington wanted to stop, paying for Americans to sit at home and sit and stay safe, right? So we had to open the economy back up. And that's kind of been where we're at, is we're in this constant state of opening and then pulling back and then opening again and pulling back. And we really haven't committed to either side. And it's that middling period that we're in that is really where we're facing a lot of the problems, is because we haven't really committed to fully opening up, or we haven't really committed to fully locking down. It's because, we are kind of with the market, we are rising and falling, we are opening and closing. As these different strains of COVID kind of cut through our population, and it's kind of deemed necessary to open back up the economy and then close the economy again and then open it back up. So I'm just curious to see, like, what are your thoughts, like, in general, and any of the potential diagnoses you have for why it is that, it seems like the market conditions of the United States have really prolonged this pandemic.
Yeah, I mean, I think it's important to know, the United States never really, in my opinion, had a hard lockdown. And that's kind of been like the first and foremost, I think, issue is that we had a series of soft lockdowns, kind of state dependent, because, you had an early Trump administration that was really reliant on making COVID a state issue. And then a Biden administration that, during the election period, was dependent on rhetoric calling for a federal solution that never really materialized. And, we've never really seen any kind of hard lockdowns nationally. I know, I was in Indiana at the time, living there, finishing up my college, when I came across the fact that, our governor had a kind of a soft lockdown for a period of time. And then everyone kind of just started saying, yeah, no, we don't like this. And then the minute a mask mandate occurred, you had local police departments going out of their way to issue statements saying they were not going to be forcing any punishment upon people who weren't following said mandates. And unfortunately, Indiana is far from the only state that's been kind of in that situation. You could look at Florida, I think is the big example, but other states like Ohio as well, and other like stereotypically conservative states, but also, you look at areas like New York City, New York is more broadly, and even in blue states, you can see that COVID is hitting everybody pretty hard. You talked about like kind of market mechanisms playing a role in this, and I definitely agree. I think the issue the U.S. has always had is that there's a general unwillingness to slow down economic growth, even in the midst of a crisis. And we've kind of gone into this like hyper capitalist mentality where the nation is not solvent should the workers not be producing at all possible times in their lives. And COVID, I think, really exposed a lot of the structural problems that we already had, which is this kind of like over reliance on this kind of like, overbearing work ethic that like Americans have been kind of subjected to for decades, and really brought a lot of the contradictions to the surface of our larger economic model. Beyond the fact that we didn't have any kind of cohesive, it seemed, pandemic policymaking, nor really any federal plan beyond mitigating the effects and enacting soft lockdowns that really kind of like started to do some damage, to COVID, or started to, do some good. There really wasn't, it seems, a larger plan. And it seems once we got a handful of things, whether that be an eviction moratorium, whether that be, a small set of stimulus packages, what have you, whether that be, small business loans that have kind of dried up as of late as well. You had these like early indicators that we might be able to have some sort of response, but that was never actually, materialized into a larger month or year long set of policies. You had the United States basically give it their best, not even give it their best, give kind of a half-assed effort, if I'm being totally honest, at pandemic response for the first half of the pandemic, when it seems our government was even taking it remotely seriously. And then the minute the party shift in leadership, the presidency and the Senate occurred, it was dropped to the side as kind of like an annoying issue that we needed to work through, that is really a problem that it's impossible to work through, right? And a lot of that, I think, is dictated by capital. You could look at CDC. CDC revisions of their quarantine policies are right around the time you start seeing Delta Airlines and other companies rallying for a reduction in quarantine periods to get their workers back and staff. You could see the elimination of eviction moratoriums that was really reinforced more heavily by SCOTUS. You could look at the erosion of unemployment benefits that occurred during the initial stages of the pandemic, the erosion of financial support programs like again, small business loans that have been kind of, reduced. And then you also look at the stimulus packages that have been wholly thrown to the side and eliminated outright. Even like things that we all thought might have been more long-term, like a child tax credit, completely failed to materialize. And the child tax credit's going to be a demon in a few months anyway during tax season, when everyone realizes that that's essentially going to be the reason why a lot of the people aren't getting tax returns that a lot of working class Americans, I'm sure, are probably expecting. But there's all sorts of systemic issues. I think, in short, my analysis, or my kind of viewpoint on it, is that capitalism, and specifically the American strain of capitalism, have really led to mass death and suffering that was pretty avoidable. And I know it's avoidable because you look at countries with significantly more population than us, or countries with significantly different ways of handling this pandemic, who have fared significantly better. China comes to mind, obviously, Vietnam, even other capitalist states like New Zealand have fared a lot better just by putting in more hardline policies and actually moving to have them followed. Now, in my opinion, New Zealand's not the best example because it's a scaling issue. The United States is vastly different than New Zealand, both politically and otherwise. But I think it's impossible to understate how well certain countries have done that don't really have this same kind of like traditional capitalist model, whether that be China, Vietnam, Cuba, et cetera. States that have, all, for all intents and purposes, with the resources they've had, handled the pandemic much, much better than our country.
No, absolutely. I agree with you there. I think that, honestly, to touch on a point that you made earlier, that feeling that, America was almost going to be forced into having to take action and to almost do this kind of quasi social democratic kind of social safety net kind of economic safety net type, motions that were going to be needed to help keep, the country afloat, right? You had the instances of the stimulus checks, and you had the instances of the eviction moratorium and all of these things, the PPP loans, and there was that real optimism. And it almost seemed like that, once you give those things away, you can't take them back. Well, unfortunately, like you said, once I think there was that shift in leadership, the party left holding the bag that needed to be the overseers of that transition back out of, giving away stimulus checks and cutting and having a moratorium on evictions. That was the Democratic Party. They were the party that took control of the Senate, basically by campaigning on, we'll give you a $2,000 check if you vote for us, right? I mean, I'm sure you remember, everyone here remembers about a year ago, the push to win Georgia and win those 2 Senate seats. Warnock and Ossoff both ran on $2,000 checks once the Democrats are in control, right? It's going to be a $2,000 check. And it took maybe a week and a half to 2 weeks for the Democrats to already start whittling that down and be like, oh, well, we didn't actually mean a $2,000 check. We meant a $1,400 check that goes on top of the $600 that you were already earned. And that's the problem, right? That's the problem. Is that a lot of Americans were immediately then starting to see, oh, great, we're only a year into this thing. We're not out of the woods yet. We have no vaccine, or at that point, the vaccine was not very well distributed yet, right? And we're already starting to administer and oversee this transition out of this scenario where the government was actually helping people for once, was actually, have these things in play that would help keep common people, working people afloat, right? In the time of, these unprecedented times that we talk about. And I think that a lot of that honestly just came down to the fact that, we didn't want to spend money where money mattered. We wanted to go back to spending money on things such as our, bloated military budget, or we wanted to give tax credits or tax cuts to, rich business owners. We had to get back to that status quo. And the party that really needed to oversee that status quo was the party that was in charge, the Democratic Party. One of the things you talked about, I think, one of the things that I think about a lot is the fact that it seems to me like there has been this real change and shift, and it could be this way all about it the whole time. Obviously, we live in a country where it's very, very difficult to receive medical care, right? Unfortunately, our country, and I think as leftists, we all agree with this. Our country is a country where, patients are kind of seen as consumers first, and then they're seen as patients. You show up to a hospital, and you could be, in pain. You could be needing emergency surgery, and sometimes, you hear horror stories of a doctor showing up to like a grieving or a scared family member of somebody that needs emergency surgery, and before they conduct surgery, asking, how are you going to pay for this, right? That seems to be the reality. And it seems like that reality that we live in, especially here in the United States, is kind of what's prolonged this issue, right? You see it with, once we started getting these at-home tests, right? And those at-home tests were kind of this breakthrough where it was like, yeah, they're not all the way, accurate, but they're at least going to give us an understanding, right? And they're a little bit nice to have like in the cupboard, for, when you have taken that PCR test and you're waiting the 7 to 10 days to get that result, which that's a whole other thing, why it's still taking 7 to 10 days for results on a COVID test when it's 2 years into the pandemic is a whole other thing. But then once the market, the invisible hand of the market, as everybody likes to talk about, the market decided that these were the hot commodity. So what happens when you have a hot commodity? Well, they get bought up, and then the ones that remain get, the price gets driven up, and you're seeing, these kind of dystopian images in the middle of a pandemic of these at-home tests, which probably, in my opinion, should be administered for free. Yesterday or 2 days ago, as we're recording this, it was announced that the United States will be providing 4 free tests per household, which is a good step. But in all reality, we should have been there a long time ago. But these at-home tests were being put, and you're seeing these dystopian images of these at-home tests in lock boxes behind glass at Walmart with a price tag of $128 or something for an at-home test. I know that where I live, an at-home test can cost up to $10, and you're only allowed to buy up to 6 of them to kind of keep people from buying a bunch of them. But you're seeing people price gouge. You're seeing people scalping these tests as if they are tickets to a Foo Fighters concert. It is absolutely incredible watching kind of this consumerism is kind of taking over humanity at this point, right? It's like we have to sell this for a profit. We have to make as much money off of this as we can. When in reality, it's like that could be a test that somebody really needs right now. A test where their entire family is positive for COVID, but they have to go to work because we are not letting people stay home. They have to go to work and they have to brave it, and that's the unfortunate reality right now. Is we're seeing scenarios like this all across the country where it seems like money and profit are being placed in front of the health of many Americans. And like you said, I think that COVID is not what brought about these problems. I think COVID is just what has brought them to light and brought them to center stage. These problems have been around in our country for a long time. This kind of for-profit healthcare system, it's all about how much money can you make and how much money can like the pharmaceutical companies make, and less about let's keep our population healthy. And I think that COVID has really exacerbated those problems, and it has brought those problems to the forefront as we've really gone in now entering our third year of this, which is absolute insanity. And it has prolonged the issue. It totally has prolonged the issue. We are the hardest hit country, right? And that's the reasons behind that are the fact that we have a group of people who are out there who are trying to profit off of this. And that's the problem is we're kind of, instead of approaching this with a humanity first mindset, we're approaching this with, how is this going to lie in my pockets, or we have to open things back up so that way the people can make more money and the economy can get back in order, instead of, I don't know, if we open things back up, then a lot of people are going to be sick. We're seeing that every day. And that's kind of the issue that I'm having. And it's an issue that a lot of people are having where morally it's just abhorrent. And I'm just curious, like, what your thoughts are on that.
Hey, you're listening to the SoleStrategies podcast. Take a moment to listen to some of our esteemed champions and their takeaways from the program.
It was very important for me to manage time, and the program again helped with the discipline of time and helping with the management of time, so that you can actually structure yourself to do that what you desire for your races.
For more information, head over to SoleStrategies.com now.
Well, I mean, I agree. I think, Americans really, we collectively need to have a serious discussion, in my opinion, about the value of a healthcare system that prioritizes short-term profits for both, the businesses running and shareholders over the general well-being of our population, and whether or not that's a system that's really sustainable, especially in the midst of a nationwide pandemic where, specifically low-income people and communities of color who historically have been kind of neglected in terms of both healthcare infrastructure investment and wealth accumulation and income, whether or not a virus that's disproportionately affecting those communities can really be fought by a healthcare system that doesn't prioritize those communities, even in good times. And I think it's a serious problem that, when we talk about healthcare, I think a lot of the framing is around cost. A lot of the framing is always around, what is it that people really deserve? Because Americans for decades have tied healthcare to employment. We've tied a lot of the things that we should really have is just basic guarantees are all tied to employment, whether that be housing, whether that be food, clean water, whether that be healthcare, et cetera, education. All of these things are essentially contingent on one's ability to be productive in an economic structure, be economically productive. And, the issue that we run into with a system like that is that system doesn't work in the best of times, really. There's always been systemic imbalances and problems, but in the worst of times, these problems are only exacerbated and only create more pain and suffering for millions of people who might have been able to avoid that pain and suffering under a different set of, of goals, or a different prioritization of both, the people within this economy and the economy itself. there's a reason in my mind why a lot of countries that have universal healthcare systems and that also have pretty robust social safety net programs are managing this pandemic a lot better than we are. And I think the reason for that is when you have a lot of Americans who, one, aren't really able to even obtain healthcare ordinarily, who are now trying to go into these massive medical facilities, stay in ERs, other areas, they're now bankrupting them. Also now dealing with disabilities that might come as a result of COVID, whether that be heart and lung problems, brain-related issues, et cetera. You're having these people struggling. On top of that, these are the same communities of people who, if you're only like 1 or 2 paychecks away from being unable to afford rent, then you taking a week off of work with no real unemployment benefit guarantees that really supplement your losses, you could lose your home. Your family could lose their home. So you now have an incentive for sick workers to continue working, thus, infecting not only other staff members, but, customers. And you've just created this really weird set of problems. And also, there's been a lot of talk about kind of the universal access to both the vaccine and, boosters, et cetera. But that's really not the case. I can't tell you the amount of people I know in low income areas, particularly communities of color, who have voiced concerns that like masks are hard to find. These vaccines are a little bit harder to find. We know just by looking at the data for the vaccine rollout that the vaccine itself was disproportionately rolled out to predominantly white areas. And even in communities of color, you're still seeing better coverage for white citizens and more wealthy citizens in these low income or communities or communities of color than their counterparts, right? I mean, like, we have these systemic imbalances that result from a for-profit system that's also, within a system that's foundationally built on white supremacy and settler colonialism, that just don't bode well in a pandemic. So we have, there's other binary, other barriers to entry too with the vaccine primarily. Excess paperwork for some low-income people, excess paperwork in low-income communities, et cetera, that have been noted by a lot of activists and organizers in these communities. And it's just, the system itself is not built to work in the best of times. And that's really indicative, I guess, of a capitalist system. But the system is especially not built to work in the worst of times. And now we're sitting through not even the worst of times with, officially less than 1 million, unofficially more than 1 million deaths from COVID. Those deaths being disproportionately working class people. And that's something our country is going to really have to wrestle with for the rest of time, is just this legacy of just death and suffering, the billions that were of dollars in costs that we're likely going to be incurring from people with long-term health complications as a result of catching COVID. Our country really is going to have to wrestle with the fact that, like, we are having all of these problems because in the short term we prioritized GDP growth, and that's really unfortunate in my mind.
No, I think that's absolutely true. I think the overwhelming scale of this tragedy that has been this pandemic is not going to be felt, I don't think, until years down the line. I think is one of the most kind of disheartening things to think about is think about a day such as 9/11, right? We talk about how the gravity of that day and the amount of life lost on that day as a day that really shook it changed the course of America, right? Well, we're having that amount of people die every single day, and Americans are completely desensitized to it. In the beginning of the pandemic, every news station had a COVID counter that would run 24/7, no matter what was on. CNN, MSNBC, Fox News, even for a while, would have those COVID counters that would tell you the global infections and the global death rate, and the United States infections, the United States death rate. And that was 2 years ago, and that was back when 1,000 people having COVID felt like a lot of people, and 1,000 people dying of COVID felt like a lot of people. And now we're at well over 3,000 people in our country are dying every single day. We're approaching slowly, but surely approaching that figure, right? And that is why this has been so abhorrent, is the fact that we have truly lost more than 1 million people to this, and it seems like it seems like we have almost been so desensitized to it now, because it's like we're so focused on bringing back, I just want my life back. I just want my life back. And it's like, well, unfortunately, we did not take the right steps in the beginning to do this, and I think that there's the early politicization of COVID as well is to blame for this. I mean, just as much as it is to blame for widespread vaccine issues, where it comes to you have the communities that obviously don't have the access to the vaccine that would like to take it, and you have the issues of the communities that have access to the vaccine and won't take it. And a lot of that is also because of the early, we politicized this virus early, and we're kind of reaping the benefits of it. And you see that on both sides. I think there's a lot of casting the Republicans as being the only team, because we really talk about as a leftist, as an outsider who kind of watches these two warring factions that are the Democratic and the Republican Party every day, and kind of feeling like, neither of them really stand up for anything I believe in. The Republicans get a lot of flack, but it is important to remember that those death counters, those COVID death counters went away from CNN and MSNBC when Joe Biden was elected president. Those COVID death counters went away, and just as much as the Fox Newses of the world wanted to kind of downplay the effects of the virus, there was also that subtle downplaying, the scale of the death and the magnitude of the absolute destruction that has been left. And we're talking economic destruction as well. There's plenty of businesses that just went belly up because the funding was pulled. PPP was the only thing keeping a lot of small businesses together. And when we decided, okay, we're opening back up now, there really wasn't anything there for them once we decided to start slowly phasing out those loans and slowly phasing out those safety nets, and you're seeing that everywhere now. If I like to step back and I like to really think about it. If you think about COVID disconnected from other times in COVID, so you think about this moment in COVID, and if you were to take yourself from, I don't know, January of 2020, right? Back when everybody was super hypersensitive to it. And there were a lot of people that weren't paying attention to world news that were completely blindsided by COVID. But I think a lot of people who were paying attention to what was going on in the world, we're starting to get a little nervous at that point, right? And I think that if you took somebody from January of 2020 and you told them, hey, look, 3,000 people are dying of COVID every day, we would immediately be in a lockdown situation. And whether that would be a full lockdown, probably not, probably closer to the quote unquote lockdown we had, right? The whole stop the spread kind of lockdown, that really didn't do much. And it really wasn't an actual lockdown in the true sense of a lockdown. I think that honestly, it just goes to show the desensitization of everything, right? Is we're so desensitized to it. We've got, large groups of school children who haven't been able to get the vaccine, who are just now able to get the vaccine, and they haven't been able to get it yet, are constantly every day going to school, going to these places where they are gathering and where they, mask or no mask, it's still spreading. The Omicron variant is still spreading in these places. And we are basically putting educators and school staff on the front lines of this. And they are, they're getting sick, and it's happening, and school children are getting sick. It's this kind of double standard that we're seeing now inherent in how we're going to treat COVID. Jen Psaki and the White House press room, made the decision that, we had to cut down on the amount of reporters that were allowed in the press room. But at the same time, we're still cramming 30 something kids into these classrooms that are just the same size. Right. And it's that double standard that we're seeing that is really, really causing harm. And I think that a lot of that, again, is because, a lot of schools are there. And because when kids had to be home, it was hard for the parents to work, which is, it's true. When parents don't, they have to go to work and they don't have a place to bring their kids. That was a hard time of the pandemic, is when, you had parents who weren't able to work from home and you had kids that were doing school from home. It's because we have tried to do both at the same time, open and close, without fully committing to one or the other. And that has been the issue, is because, again, it's trying to mitigate the virus while also keeping the economy going and keeping the market happy. In the capitalist sense. That has been the problem, is this both sidesing of it, which kind of leaves us in the middle here, completely vulnerable to large amounts of infections and large amounts of people who are falling ill. And like you said, you kind of touched on at the end there, the true repercussions of this pandemic are not going to be felt until like decades on, when we really do kind of figure out the people who are going to be having lasting health effects to this. And, to put it in the minds of a capitalist, unfortunately, the way that you get to there, when we talk about healthcare, you said it, we talk about it in terms of money and how much this is going to cost. How much is this going to cost? How much is this going to cost? Well, if I'm going to, throw away my morality real quickly and like get in the weeds and talk about the pandemic in terms of cost like that, in a way that's going to actually speak something and speak volumes to those types of people, people who are not you or I in our economic beliefs. This pandemic is going to end up costing millions upon millions upon millions upon billions, right? Because what is the total cost? Maybe even trillions, right? The total cost of all of the healthcare and all of the operations and all of the medicine and all of the, all of that stuff that's going to go into taking care of people who had COVID, got over it, but are now dealing with the effects of quote unquote long COVID, as we call it, for the rest of their lives. And is that number a good enough number? Like, is that the number that we are taking over, the number that would have been, here's what it would have been to give everybody access to healthcare. Here's what the number would have been to have everybody locked down and to keep everybody locked down and to keep providing those stimulus checks, those survival checks, as we called them, and to keep giving out PPP loans to keep those small businesses alive because they needed it to survive. It's like, if you're going to play the money game, unfortunately, I think that, the money game was short-term profit, long-term, we are now going to have this mess on our hands and it's going to cost a lot of money. And unfortunately, like, it sickens me to have to talk that way, because like, that is not how I see this issue. I see this issue as a humane issue, as a moral issue. But if you want to talk about it as an economic issue, the economic effects of COVID are going to be felt for generations and generations, because we did not do it correctly. And I mean, that's just how I feel about the issue. And I can't help but wonder, what it would have looked like had we had a more humane, a more people first, a more healthcare focused approach to this, instead of a profit motivated approach to how to deal with COVID and get over COVID as fast as we can. So that way, the market could get back to the way it was.
No, I agree. There's this, there's a movie. It's one of my all-time favorites personally. It's called The Big Short. And in it, basically, for background on people who might not have seen it already, the Big Short is basically just a film about the 2008 financial crisis and a group of investors who were able to kind of predict it and basically bet against the housing market a year or two before 2008. And one of the characters, this like ex-banker at one point says that, is they're celebrating, or these two characters are celebrating, realizing that they were correct. He makes the point that the thing that he hated about like banking, and the thing that I think I hate most about kind of a lot of the broader discussions of COVID, is that it reduces everybody to numbers, right? And the human suffering that is occurring nationwide, disproportionately felt in Black and Indigenous communities and low-income communities and communities that have been traditionally neglected already by our government, is incalculable. Each one of those millions of people likely had a family, those million plus had a family, probably had friends, had someone they've interacted with who they've impacted. That's a lot of suffering. That's a lot of pain. That's a lot of grieving. And that's not even including people who are now dealing with disabilities and dealing with restrictions on what they can do, on what their bodies are capable of, things they would have never in their lives, I think, feared they would have had to have dealt with. These are the real problems, I think, inherent in the system that we have. And it's frankly kind of terrifying. And, to bring it full circle, like, this is the result of our economic model. There, in my mind, there is no ifs, ands, or buts about it. Our country chose capitalism over the general well-being of the people, because we live in a system that is not sustainable, that doesn't value the lives of workers beyond their productivity levels, and that really values the accumulation of capital more than the accumulation of health, or the retaining of a healthy population. We've seen billionaires, and I know everyone who follows any progressives on anything has seen the statistic. We've seen billionaires make record profits as millions across the world have died. We've seen, Jeff Bezos, for example, Elon Musk make billions, if not trillions, during this pandemic, as millions of us nationwide struggle to even get our government to give us, more than $1,400. It's disheartening. And a lot of it is, in my opinion, driven by corporate interests, by business interests. These major players, major corporations who would rather see their workers temporarily at work, rather than staying home and taking the necessary precautions they need. And that's unfortunately the issue with allowing entities that are profit driven to dictate quarantine policy, to dictate pandemic policy and what have you, is that you're never actually going to get policies that adequately account for the damage done to the working class, because the working class is, again, always, in any discussion in the United States, whittled down to a set of numbers and a set of figures that are and are not manageable, dependent on the whims of whomever's in leadership at the time. And I think that's something we're all going to have to really wrestle with. And I think furthermore, we're really going to have to wrestle with the fact that our system fundamentally showed it bared its own fangs, and it really showed itself in that both major parties, the minute they had the power and ability to do really anything, have chosen essentially apathy, and doing little to nothing that would alleviate some of the financial and health stress being felt by a lot of people nationwide. The Biden administration, they expanded COBRA, which is a healthcare oriented thing that really didn't do a whole lot of good. They've openly been against things like Medicare for all, which, if not in this pandemic, in the next would be a lifesaver, I'm sure, for millions. They've been against raising the minimum wage so workers don't have to work as many hours to be able to retain their basic needs. They've fought against or really had lukewarm support at best of things like eviction and rent moratoriums. Although, in the Biden administration's defense, this is the rare time I'll ever come to their defense, SCOTUS really did drop the ball on eviction moratoriums. And then the Senate and the House refused to really pick it up. You have all of these things. You have the reduction of unemployment benefits, the refusal of another stimulus package, the unwillingness to cancel student debt, which is a massive debt burden, is particularly on younger generations as wages have stagnated and debt has soared, creating functionally a bubble that, though not as large, is similar in a lot of ways to the housing bubble we were facing in 2008. And thanks to Joe Biden, actually, Americans are unable to default and declare bankruptcy on those loans due to existing legislation that he pushed through. So we're in a system, as much as I try to be an optimist, we're in a system that really does prioritize short-term economic profit over anything, even if that means killing more than 1 million Americans for the sake of blood sacrifice to the capitalist economic machine. And that's, I don't really have words for that, if I'm being totally honest with you.
Yeah, and unfortunately, there really is it's kind of hard to put a positive spin as we wrap up here. It's really hard to put a positive spin on these events, because I think, like you said, all COVID did was really highlight and bring light to the darkest and most backwards parts of the American machine, right? One thing that's never been lost on me, kind of as now we're about 2 years out from when, that we felt like we were actually doing something. I will come full circle. I will open up and say, yeah, I was a Bernie Sanders supporter. And I did a lot of volunteer work for Bernie Sanders, and it's not lost on me. Like you said, Medicare for all could have saved, if not in this pandemic, then in the next, could have helped, at least helped millions upon millions of people be better equipped to deal with this. And it definitely would have saved thousands. I can't help but think about the irony that when this pandemic that had a pandemic of the scale which had not been seen in a century came knocking on the door, the candidate that was pushing as his number one platform, as his number one policy, a complete overhaul of the healthcare system of this country, he was going to drag this country into the 21st century when it comes to healthcare. The establishment came together and made sure it didn't happen. With all of this going on in the background, with COVID surging, making its way outside of the original infection areas and kind of spreading across the globe like wildfire, the man in the candidacy and the campaign and the whole idea that was hopefully going to bring about a response was seemingly kind of had the rug pulled out from underneath them, right? And I think that's how we all felt, where a lot of early wins, and then the machine kind of put a stop to that because that's not what's supposed to happen. And I absolutely do believe that in an alternate timeline, if we do have a different administration, potentially there is a different outcome, or at least there's more done. I feel like there's debt cancellation, and then there's at least a push to kind of fight back against this for-profit healthcare system that we have in this country that has really, really done the damage. And I guess like the one thing that we can take away from this, is just we need to learn from our mistakes sooner or later, because there are more pandemics out there and there are more scenarios like this out there. And if anything, COVID bringing to light how ill-equipped the United States of America was to deal with this issue on a global scale, has really kind of, I want to say COVID has probably sped along the death of American empire, to not overstate it. Because it really has shown just how ill-equipped we are to handle any issue of this magnitude. And I guess that's just something to leave you with, something to kind of ponder as we head into the next week. Thank you again, James. Obviously, if you want to check James out on Twitter, James, you want to give your social media handles as we sign off here?
Yeah, sure. You can. I do a lot of political discussions and education across platforms. You can find me on Twitter at Make It Rain, and you can find me on TikTok at James Gets Political.
Yeah, and for me, it's TikTok. I still use my TikTok every now and again, and my Twitter at Steve's the Means. And thank you for listening to another SoleStrategies podcast. We'll be back up here next week. And just something to part with, when we talk about things like this, it can be very hard to kind of remain optimistic, obviously. And it's kind of hard to put a positive spin on things. But if anything, let the last 2 years and counting of COVID capitalism kind of, if anything, let that kind of give you a feeling for how badly we need people who are willing to make change and fight for change in this country. So thank you again, and we'll see you next week.